Hello, everyone. Welcome back to another session of A Day with your fertility specialist. Thank you for joining us. I'm your host, Joanna Damina, for today. Today, we have an interesting topic. As always, we're talking about IVF success rates, right? IVF is not always just something that happens by chance, or it's not even that. And there are things that could be done, or things that can be applied throughout your IVF journey or your fertility journey that improves your chances and your success rates. So if you know someone that is interested in this topic or you yourself are interested in this topic, please stick around, share this to them. We really do appreciate every click, every like, and every comment on here. You can as well drop your comments or your questions in our description box below, our comment section below, so that we can answer you better. Our goal is always to make you more informed on the decisions that you're taking. Now, joining us today to talk about IVF success rate is Dr. Ken. Hello, sir. Welcome. Lovely to have you. Dr. Ken is a consultant gynecologist. He's also an IVF specialist. So this is somebody that has a lot of information on this topic, right? He's a fertility specialist all round. So he has a lot of information on how these things goes. He has seen this multiple times over and over again. And yes, we're just going to make this more of a learning session. Okay, so Dr. Ken, IVF success rate, right? It's kind of a I'll say it's a big thing. Everybody tries IVF wants to succeed, but what does it actually mean? What does the rate at which you succeed actually mean?
I'm struggling to understand the
My
question
question.
itself.
Okay.
You know, the success rate. Yeah, there's a rate for success. For instance, for IVF, worldwide success rate for IVF seems to range between 30 to 38%.
Okay.
And that's to say that if you put all the age groups of people doing IVF and you factor in everything you need to factor in, the rate at which they'll succeed is about 32 to 38%. When you put all age groups together. But we then know that all things being equal, the younger age group succeed easier and quicker than the advanced age group. So everyone who is going to have an IVF, for instance, I know in the last couple of days, I've had to do some online consultation, and one of the frequent questions I ask, what is your success rate?
Yeah, exactly.
You
Yeah.
know, it's a question that is always very difficult to answer because you ask me what the success rate in ARBS hospitals is for IVF, for instance, in relation to you,
Yeah.
makes no sense to me. Because success rate is not calculated based on what you think. It takes a whole lot
Okay.
to come around or to come about the success rates.
Yeah.
But then success rate, if you ask me, when it comes from a direct question like this, is individualized.
Okay. Yeah.
It's individualized. So when it is success rate, it's trying to ask or find out how easy it is for them to succeed.
That's true.
How
Yeah.
easy it is to succeed. Or when so number of women go through your fertility treatment, how many of them succeed? So that's what they are looking at. And it's always a very tricky question.
Yeah, I can
But
imagine.
globally, as I said earlier, 32 to 38% is the world success rate. But then, if you look at stratification, from what we have seen, the young age group between 22, 21 to 27, they have close to 60 to 70% chances of succeeding if
Interesting.
everything is fine.
Yeah.
Then as you go higher, the chances is reduced from
Reduces.
age of 38 to 40, for instance, about 20 to 15%. At 40, about 10% chances of succeeding using an individual's egg. Then at 46, 1% chance of succeeding using an individual's egg. But if you're using a donor egg, for instance, at the age is increasing, the chances of succeeding increases up to about 60%, 60 to 70% if you're using a donor egg.
Yeah.
If everything is equal, everything is standardized, because you could have a lot of good gametes, but if other factors that affect success are not in good conditions, then
Yeah.
of course the success rate
Success
can
rate going
still
to be
be
judged.
elusive.
Yeah. Okay, but how do we actually measure success rates? Is it just by achieving pregnancy, or is it actually getting to the point of delivery? Like at what point would you say IVF is a success?
Oh, that's a tricky one now. If you look at the success rate of IVF when it's talk about the uh, take home baby rates, it's usually stratified.
Okay.
As pregnancy rate, as in just having a positive pregnancy,
Yeah.
maybe you can consider as a successful IVF.
Mm-hmm.
But the goal, or what is eventually uh, tagged as success in IVF, is take home baby rate.
Oh, okay.
You understand?
Mm-hmm.
You do an IVF, you succeeded, you have a baby, you deliver the baby, and you take the baby home. But then, if you look at it from IVF perspective,
Mm.
IVF is successful when a clinical pregnancy is identified,
Okay.
by ultrasound.
Yeah.
That is when IVF is successful. And that is what the success rate should be about, because once pregnancy happens, the others are obstetric indices.
Okay.
The fate of the pregnancy is similar to the fate of pregnancy that is conceived spontaneously. So at that point, if you ask me, IVF is out of
It's
question.
out of it, yeah.
It's just obstetrics. So success rate is clinical pregnancy.
Okay, that's interesting.
Clinical
Yeah, I see
pregnancy.
where that
Yeah,
makes a very big difference between
exactly.
deliveries and then pregnancies itself.
Exactly.
But why would you say it varies so much between individuals? Like you mentioned, younger women and then more women more advanced in age. What are the factors that affect women more advanced in age when it comes to IVF?
Now we battle with this all the time. Fertility, to a large extent, before now we think of the age of the woman. Yes, and this is because the age of the woman affects the quality of the eggs of the woman.
Okay.
The younger a woman is, the better the quality of her eggs. And then if everything is left to the eggs, let's say the sperms are fine, the lining of the uterus is fine, then it means her chances of succeeding is going to be very high if she is young.
Yeah.
But as women grow older, the number of eggs reduce, then the quality of the eggs deteriorates, and there's what we call a ovarian apoptosis index. Apoptosis is a kind of word that means a programmed cell death. The rate of attrition of the eggs and chromosomal abnormalities
Yeah.
increase as the women are getting older.
Okay.
And that is why they produce a lot of some eggs, and then not all the eggs are good enough for fertilization or for pregnancies. And for those who are embryologists, for instance, they mention to you that the shell of the egg is thick,
Yeah.
difficult for fertilization to go on with it. And then you do a fertilization, you have a lot of fragmentations, because of the quality of the eggs. And of course, you see the color of the egg. Sometimes the colors are so awful, as against the crystal, clear, glass-like kind of color that you see when eggs are looking fine.
Yeah.
So as women get older, all of these abnormalities happens with the eggs. The quality depreciates, the number depreciates, the chromosomal abnormalities may increase, and then the chance of getting pregnant with the eggs becomes poorer. So this is natural, and nothing changes it.
Yeah.
Nothing changes it. It's just the way nature is, and everyone must follow the course of that nature. So if a 43 or 44-year-old woman calls on phone, for instance, and asks, what is the success rate?
It's gonna be
You can imagine what kind of
Yeah,
answers you want to give. And now it
exactly.
depends if you're using your eggs or you're using a donor egg. So when she has all her evaluations, dealing with all the doctors she's dealing with, then she can be told what chances
Yes.
she is disposed to. And it doesn't just depend on the egg now. The partner sperms
Exactly.
is another
What are
thing.
some other
A
main
good
factors?
number of the failures these days are even sperm related.
Wow.
And then a lady can be young,
Mm.
as young as, let's say, 20, 21, 25. And then at that age, you expect high chances of succeeding.
Yeah.
But if the partner has poor sperms, for instance, the chance of succeeding is lowered. So there's a lot that affect the chances of an individual getting successful
With
with
IVF.
IVF. So age is one very negative factor.
Yeah, I can see how that would go.
Very
Yeah.
negative factor.
There's a lot of things that are already, being reduced already.
Exactly.
So chances are
Yeah, age
lowered
is a very
automatically.
important factor.
Yeah.
If a younger age group woman, for instance, has good sperm, has good eggs, but the lining of the uterus is not good,
Oh, exactly.
there's a
That's
lot to
another
bring
thing.
about pregnancy.
Yeah.
So all factors have to be good for chances to be high. So if you're talking to a young girl, for instance, okay, you're happy seeing her because she's fine, she's young. Chances that the eggs are fine is high.
Yeah.
But then what happens to the lining of the womb? If she had had a damaged lining of the womb, for instance, the chances is still
It's
going to
really
be very
low.
low.
Yeah.
So it's a whole lot. Yeah, a whole lot.
So how do underlying, conditions play a factor in that? Let me speak especially about things that we spoke about here, like endometriosis, adenomyosis, and if I can't remember which one
I
was the
don't like
number
hearing
one
this
or the
song. This
number
is Good
two.
Friday.
PCOS. There was one that you said you really don't like or you hate or something. I don't know which one was number one or number two, but I know
Is
that these are things.
adenomyosis. I don't like
Okay. So
adenomyosis.
these are
Endometriosis.
some.
Then the third is PCOS.
Exactly, and I'm talking about all of them, all your
They all have
nemesis.
negative factors. They are all negative factors that affect the rates, the success
Yeah,
negatively.
yeah,
If everything is fine and a woman has a global adenomyosis, for instance, chances of failure is higher there. And if she has endometriosis, for instance, chances of even having good eggs is reduced.
yeah.
And then chances of getting pregnant is lowered. Then if she has polycystic ovary, chances of producing good eggs is lowered. And chances of getting pregnant is lowered. So these are all factors that could affect the success for an IVF with what you have mentioned so far. These are negative conditions. Then if you look at other conditions, for instance, let's say thyroid abnormalities. Women, some individuals could have hyperthyroidism, or some even have hypothyroidism, abnormalities with the thyroid gland.
Yeah.
This can affect the process of egg development, and then it can affect the process of pregnancy if it is not well managed.
Yeah.
Then if a woman have sugar diabetes, for instance, it also affects the process of egg development, process of fertilization, affects the health of of the baby, and can predispose the woman to having abnormal babies. Then can cause miscarriages to happen. So these are things that could affect success rate. But then for a woman who had had adhesions in the uterine lining, as an Asherman syndrome, intrauterine synechia, these are very, very bad conditions that could make a woman fail following an IVF treatment cycle. So success rate can actually be very challenging to talk about.
Yeah.
Can be very challenging to talk about because everything may just be fine, but something is just not okay.
It's just not working the way it's
Something will just
supposed
not be okay.
to.
Yeah, we talk a lot about these things in the woman, but the man produces only sperms, and then the sperm could have a lot of problem
Yeah.
that can make good eggs useless. Yeah, for instance, if a man have high level of DNA fragmentation, the chance of having pregnancy or achieving success is lowered.
Lord, yeah.
If the movement of the sperms are poor or they don't even move at all, chance of getting pregnant is lower. And if the sperms are low in count, for instance, you could achieve pregnancy because that's what IVF can help with.
Yeah.
But then the chance of succeeding is also lower because if the sperms are so low, are so low in count, low in movement, and poor in the way they look morphology, then of course it means the sperms are sick.
Yeah.
So using a healthy egg and a sick sperm chance of getting success is low. Yeah, occasionally these sperms can bring about pregnancy if genetic contents of the sperms are all right.
So, okay.
But more often than not,
Actually,
the
it's
chances is poor.
lower chances.
Then some sperms could have a lot of oxidative radicals with them. Then, of course, older men's sperms are also not very healthy.
Another age
That's
thing.
yes, that's aging. Aging
Yeah.
affects men. I mean, affects reproduction in men as aging affects reproduction in women.
Yeah.
So the older the man, the less potent the sperms are. They could get a woman pregnant, but with all the things that goes along with it, and then the chance of not even getting a woman pregnant is high
also there,
if a
yeah.
man is too old. Question is, what is too old? I don't know what is too old. So those are all the things with the sperm. Of course, if the man also has diabetes, the chance of making a woman pregnant is quite low. Exactly. Poorly controlled diabetes, for instance. Then if the man is hypertensive and on some strange medications, there are some medications for hypertension that affect sperm. They control your blood pressure, but they affect the sperms negatively. So we always take all this history. So some medications may need to be changed before we ask the man to do his before we request for the sperms for fertility treatment, for
So you have
IVF
a
treatment.
better idea of what
Exactly.
it is.
If a man also have thyroid abnormalities, he could produce poor sperms. Just the way they affect the woman, they affect the man.
Exactly.
But before now, all attention has been on the woman.
Yeah.
But it's modern world now. We look more onto the sperms because the sperm seems to be undergoing a lot of attrition, following a lot of factors that men are exposed to.
Yeah.
Health of the man, the age of the man, the substances the man consume, and the lifestyle of the man generally.
Okay.
Yeah. Even obesity affects sperm.
Wow.
Yeah, obesity affects sperm in men. Yeah, just the way it affects eggs in women, it affects the sperms too.
Yeah, I was actually going to talk about that because I know something that is usually used to measure obesity is like the body mass index. So how that actually affects. So that's even a role that affects what you get to work with in IVF. But how about embryo quality? Let's say we do end up getting how would I say, end up getting a good sperm and good eggs, or let's say not so good sperm or not and good eggs, but they end up actually growing up an embryo. How do you get to know what the chances of success are? I mean, are there like gradings to these embryos that you say, okay, this is a better one than this other one, and pregnancy?
So now you see, analyzing the embryo is another kettle of fish. And to a large extent, a lot of embryos are graded subjectively.
Okay.
Yes, there is an objective way to look at the embryos, but even in the objectivity of looking at embryo, there's a lot of subjectivity with it because we all see embryos just the way they are. But only few embryos get to be evaluated to their genetic level.
That's true.
You understand? And that is when you really know that you've done a good objective. I mean, you objectively evaluated an embryos. So yes, all of these sperms and the eggs produce embryos. But what you see in the development of the embryos is a reflection of what the eggs look like, or what the sperm look like, or what both of them look like. Because all of these gamete embryos. So if the sperm is poor from the onset, it will have an effect on the embryo. If the egg is poor from onset, it will also have effect on it. If both are average, because you have an average kind of embryo. Then if they are gametes from older people, for instance, they have a lot of genetic abnormalities that will not even form pregnancy. And they will have all the physical abnormalities that the embryologist will see. Abnormalities like having a lot of fragments in the embryos, or delayed in development. Maybe you're getting to day 5 and these embryos are still looking like day 3 or day 4 embryos. Or sometimes you just see an arrest in the development of the embryo. Or sometimes the eggs are just dead. They don't just have signs of life in them. So all of this is a reflection of the quality of eggs and the quality of sperms. That's just what it is.
Interesting.
Embryos are they just tell the story of where the egg come from and where the sperms come from. That's just it.
So from the onset, you actually do have to, have a better, would I say, quality of both egg and sperm
Mm-hmm.
to actually achieve good
Exactly.
quality embryos.
Exactly.
Okay. So we
Exactly.
have a question here from Calvin Gaji on Facebook. Thank you for tuning in and you're paying attention because he says, "What is DNA fragmentation?" Because I know you just mentioned it anyway, and somebody out there
Oh
has
dear
no
Lord.
idea what that even means.
Yes. So you see the head of the sperm. You know, if the sperm. By the way, my key holder is a sperm. Crazy kid, right?
You're too involved in the whole
Oh
fertility
yes.
thing.
I don't know why. So the key holder is a sperm. I wish the key holder is here. I would have shown the guy right now. So the head of the sperm is like a tadpole head,
Yeah.
and then it has a neck,
Right.
then it has a tail. And these have the normal way they look. So now the head of the sperm, it's where the DNA apparatus are. You understand?
Yeah.
So, and depending on the lifestyle or the health of the person, the DNA can be
I just
affected.
googled up a picture. I don't know
You
if we can
understand?
show this. Will this work?
Let's see. Oh, that's beautiful. Yeah. So, if Kelvin is seeing this now, right now, I wish I have a screen. This
Yeah.
is like the head of the sperm. This is the neck, and this is the body and tail. So this head here, this head here, that's where the DNA materials are, and then they can be damaged. And now the health of the sperm actually is I mean, is understood by by the nature of the DNA, the way the DNA looks. So if the DNA is not fragmented, or the rate of fragmentation is low, it means that the sperm is more or less healthy. So there are some kind of people, depending on the lifestyle, if you have a lot of stress, you
Yeah.
can be young, or if you're older, or you're on some kind of medication or social recreational drugs, this can affect the DNA. And then if the DNA is not healthy, what are you transmitting?
Exactly. It's very
Poor
DNA.
sperms
Poor sperm.
with poor DNA. And then what do you expect? Poor fertilization and poor outcome. So when we see conditions where everything is fine and pregnancy is not still happening, we do DNA analysis. In ARPS hospitals, for instance, when guys have come in with challenge sperms,
Yeah.
or have had history of IVF without success and everything seems to be okay, we go looking down to the DNA of the sperms and see the degree of fragmentation,
Okay.
because the degree of fragmentation tells you what to expect, number one,
Yeah.
and what kind of approach to
Okay.
fertilization you should adopt,
Yeah.
or what kind of advice you should give them. That way, they're able to put their expectations where it should be. So this is what the sperm looks like, and that's what DNA fragmentation in a
I hope you can
nutshell.
see that,
It just tells
Calvin.
about
Yeah.
the health of of the
Of the
sperms.
sperm.
Yeah,
Okay.
thank
Well,
you.
that's interesting. And then we have interesting new tech. Let me not say new technologies because I think they've been here a lot longer than you think, but more advanced technologies in IVF, like ICSI
Uh-huh.
or PGT. Things like that. Do those also affect the success rate of an IVF treatment?
Exactly. So now you see, what we're talking about is success rate. We talked about initially. I did mention the subjective way that
Yeah.
embryos are evaluated. For you to objectively tell whether an embryo is good or not, you want to do what the DNA, I mean, the genetic content is, and that leads you to what you call pre-implantation genetic diagnosis.
Yeah.
You know, if you do a pre-implantation genetic diagnosis, embryos that we think are fine will be seen not to be
Not to
fine.
be okay.
But then this is actually not done often because it's terribly expensive.
Yeah.
You have to have a strong reason why that should be done. Especially when you're chasing some genetic disease conditions, some syndromes and all of that, then you want to do all of that. Okay. So, yes, this can be applied if it is so cheap and easy to
If
do,
it was, if
to tell
only.
us that these embryos are fine. Because sometimes when we do this pre-implantation genetic diagnosis, you see 10 embryos you think are all fine. At the end of the day, you come down with only 2 good embryos.
Wow.
And then in your choices, your selection of which embryo to transfer, you may not have chosen
Those good
those
too.
good
Yeah.
tools. You understand? So if this is applied to everyone,
Yeah.
then of course, you see, you would have been able to tell that you have made the right choices, and then it's what it is. But it's very expensive to do.
Yeah, I can
It's very
imagine.
expensive. But this is not to say that the conventional way of selection doesn't help. It helps a lot. But PGD is just too costly and cannot be applied to
Everywhere,
everyone,
yeah. Though it's an option.
except there is a crazy reason for it to be
Like you have to be
applied.
very, very, very intense
Yes. But
on
if I want to have kids,
something.
I'm going to do
I
PGD.
mean, it does sound interesting.
Uh,
Do that as well.
I'm going to have
But
PGD.
for you said you've spoken about the lining of the womb, right?
Yes.
How important is the role of that area? How important is the receptiveness of, let me say, of that area? That's like the endometrium, right? We've spoken about that as well, where the baby is growing, or where the baby should grow, or implants, or all those terms.
At the end of the day, when you have your selection of embryos,
Mm-hmm.
whether by the conventional means of using the pre-implantation genetic diagnosis, doing all your stimulation and have all your hormones under control,
Yeah.
the lining of the womb is the next thing.
Mm-hmm.
That is the final place that implantation happens. And that's where the embryos grows, becomes fetus, grows, become a baby to be
Baby.
delivered,
Yeah.
and all of that. So if you ask me, actually, that is to me one of the most revered part of the human reproduction, the endometrium. Because if it is affected,
All the good work.
all
that
the
you
good works
personalized.
is nonsense.
Yeah.
You know, it's important to keep to have a good evaluation of it, and it's important to keep it healthy.
Exactly. So how can it actually be kept healthy, or even, let me say, optimized before the completion of an IVF treatment?
Yes, you first of all have to look at it, maybe doing following the woman history, for instance. If she had had a lot of termination of pregnancies,
Yeah.
like using the DNC or evacuation, these are crazy procedures that are not necessarily healthy to the human body,
Yeah.
because you scrape off everything in the lining of the uterus, the place where the baby is and the place where the baby is not,
Isn't, yeah.
the bad and the good place. You scrape all because you do it blindly. And by the way, the MVA evacuations and the DNC are already been programmed to be termed obsolete in the practice of modern medicine, because an embryo just sticks into one part of the
Exactly,
endometrium, But when you want to remove the fetus, you scrape every part together with the part where the embryo is attached, because you're doing it blindly.
Yeah.
So it is advised that it should be done under vision hysteroscopy. So you only take out
Just the part
the part where you want to take the baby out from.
Yeah.
So you don't scrape everywhere. So you see, when a woman has a history that these kind of procedures have been done, you need to now look into the womb, a telescope, which is a hysteroscope, to see whether it's healthy or not. If it's not healthy, do what it takes to fix it. Then if a woman has had a fibroid surgery, for instance, maybe the lining of the womb is affected, you want to also look at it. Then, of course, if there are other lesions you see on ultrasound scan that are confusing, not too clear, and other modalities didn't clarify them, you can also do hysteroscope to make sure that the health of the lining of the womb is fine before going ahead. Because if you see adhesions, for instance, or you see growths, you have to take them out. That way, you are improving the woman's chance getting pregnant. Yeah. So then, of course, if the hormones are not in good condition during the treatment, you may have to stop and prepare the woman afresh, so that the window of implantation is improved. So there are quite a number of things that can be done. And if, of course, you have a very bad condition with endometrium, you could do endometrial rejuvenation, using the precursor stem cells, the PRP, or whatever additions you have to it, to improve the woman's chance. Yes. So there are quite a number of options. Some of them are experimental, some of them are established already, but anything to improve a chance is a good thing to do.
Anything is a good thing, actually.
So for me, I worry so much about the lining of the uterus, because you can easily get good eggs, either from the woman or from elsewhere. You could get good sperm from elsewhere or from the partner. But the woman needs to be pregnant. So that lining of the womb needs to be okay. Otherwise, you'll be thinking of surrogacy.
Oh, wow.
Which is a complicated treatment to do.
I mean, it's already,
a third party involvement.
Exactly, there's already
a third or fourth party involvement.
And it's just like, well, speaking about preparations, we have two women that have questions about that. We have Lily and Julius. Thank you. She says, for how long do you for a woman, how long do you prepare the body for IVF? And then we have Noji Ishaya says, is it necessary or important for women to take supplements before undergoing IVF? And supplements is a very broad
Yeah, the
term.
supplements are
So
fine. Let's start with the supplements, for
yeah, okay.
instance, especially for aging women.
Mm-hmm.
Supplements, for instance, are necessary in case an individual is being diagnosed with the lack of certain supplements.
Mm-hmm.
We have some studies that have shown that women that cover themselves with hijab, for instance, maybe like in vitamin D3,
Yeah,
D3,
yeah.
they go on, you give them such supplement, especially if you do an assay of such supplement and they are not adequate in the body, you supplement. Then any other supplement that looks deficient can be supplemented. Then for the aging women, for instance, the quality of an egg to a large extent depends on the strength of the mitochondria. Mitochondria is like the powerhouse of a cell
Yeah.
from our biology of primary school, powerhouse of the cell. So now, as the woman is aging, the mitochondria are also becoming weaker,
Yeah.
and these are fertilization. So there are medications that help with the mitochondria, for instance, the vitamin D3 and coenzyme Q10. They call it CoQ10. That's the slang that women have. The CoQ10.
Yeah.
You be queen on. So those help with improving the mitochondria a bit and can increase the chance of success a little.
Okay.
So a good number of supplement, the folic acid, for instance, is a beautiful supplement.
Oh, interesting.
Yeah, because if a woman is deficient in folic acid, it can affect the quality of the baby she has. So you give all of those supplements. Then, of course, there are a lot of micro minerals or micronutrients, the selenium, the zinc, the vitamin C, and all of that. They can also be very important because one way or the other, they help with the quality of gametes, whether in the man or in the woman. So the supplements are fine. But then, if you discuss with your doctor, it should be his prerogative to advise you on what kind of supplements you would take. The older women have quite a number of supplements they could take. The younger ones, quite a number of supplements they could take. But then it doesn't just translate to success in IVF. You understand? But it helps your body prepare for the process you're going through. So the other question
She
is,
said, how long as a woman?
yeah, there's no
you
length of
prepare?
time. It all is individualized. There are people that it takes a month or two to get them ready, and there are other people that it takes a year to get ready, and some people 6 months to get ready. It all depends on what you're working on. If you're dealing with sperms, for instance, the sperms are bad, and you're going to give medication for sperm, of course, it shouldn't be less than 3 months. There are endometrium that takes like 6 months to get them in the right condition, if they ever get to the right condition. You understand? There are some conditions that it takes a year to get them ready. While others, you can just do your IVF treatment immediately because you just come prepared. So it's individualized.
Depends on
and
what
it
you
depends
see.
on your own peculiarities. So no set time.
That's an interesting takeaway I'm getting from this. Success rate is very much individualized.
You can tell me now.
Yeah.
It's very
It's very
individualized.
individualized.
Yeah. So and your pathway in an IVF treatment may just be different from some other person's pathway. Yeah.
Okay.
We've had a lady before in one of the European countries where I shadow, had a bad endometrium, and I love my boss. He's a very interesting scientist,
That's nice.
very technical. Uh, shaped the entire endometrium and used very sophisticated means and regrew healthy endometrium in 6 months.
Wow, that's
You understand?
beautiful.
So this kind of woman will be made to wait to get ready before something happens. Yeah, so it just individualized. Yeah, just individualized.
Okay. I think we're getting to the end of this. Although we have a few comments that would get into. We have a very interactive session today. People asking about what kind of evaluations a man is supposed to take. I know you spoke about the shape, the movement, and the quality and things, and what can be done to improve implantation chances. Of course, this is something we also covered. Thank you, Noji, for that. We just spoke about that. But let's talk about some lifestyle, some lifestyle habits or changes that can improve success rates. I heard things like that. You spoke about obesity. I'm sure that's a lifestyle thing. You can lose weight if it's not otherwise contraindicated some other condition. So what kind of lifestyle habits do you think a person can carry out or can implement to have a better weight?
Yeah, eating healthy. healthy diet. Healthy diet is becoming difficult to talk about in this our day and time, but healthy diet is important. Whatever the healthy diet now represents to your society should be talked about. Then, of course, if somebody has a habit of taking recreational or social drugs, it's going to be important to cut down on all of those things because they increase oxidative radicals in the system. The oxidative radicals don't just only affect the sperms, or the eggs; they affect the entire health of the human cells. So alcohol consumption and cigarette consumption are okay also to reduce or to stop if it's possible to stop them. Then of course weight loss is okay, because when you do some weight loss you improve on your hormone milieu, and that can improve on the healthy development of gametes. There's hardly anything you can do about age, but that's the lifestyle modification that can come in. It's a whole lot. The rest, depends on age. Then the second lot depends on lifestyle.
Depends on your lifestyle. Well, that's interesting. There are definitely more scientific things and more lifestyle things. We're just asking that just so in case you're carrying out some of these habits that are detrimental to you, you might want to stop them. So just to round it up, in your experience, you've been doing this for quite a while. I know you've also had some international experience. What would you say is your big tip to your clients about things that they can do, like an advice you would say that would improve their success, whether it's related to lifestyle or medications, parents and all of that, so their discussions with their fertility specialists?
Yeah, what I would rather say is people should respect and go with good counseling from their doctors.
Very important.
Yes, that for me should be the first thing because most times people don't want to go with advice from the doctor. Yeah, for instance, you're dealing with a woman who is very old, and then she still insists on using her gametes, and in the past 3 weeks, for instance, I think if there's one challenge I've had to deal with, it is this. And of course, you can tell where the end result is going to be like. A lot of women would, or a lot of couples would stick with what makes comfort for them,
What's more comfortable?
and which may not really translate to having good outcome. Even when they have tried it before and the outcome was poor. So there may be a lot of reasons for this, but it's good to come to terms with the current situation of your body. Age is age, nothing changes it. So when you're at that stage, be wise and take a very good counsel. For me, that would be the best thing I have to say. If your doctor thinks you should consider donation, it's good to consider it. I know it's not that easy. If you also ask me to consider, it may not become very easy, but we have to face reality at that point in time.
Especially if you've had multiple attempts.
Exactly, especially if you've had multiple attempts and multiple failures. So it's good to understand the capacity of your gametes at your age at that point in time.
And what can be done to help.
Be done to help. That's true.
Well, thank you so much, Dr. Ken. As always, it's lovely to have you here.
Thank you.
And I'm really sure our viewers enjoyed today's sessions, considering how much, we had comments and questions. So thank you so much. That was very interactive. And I hope that, made you more knowledgeable about your choices, the counseling that you get and adhering to such things. You never know what change might be made in your IVF journey that would actually lead to success. So just implement these things. There's the tip of changing some of your lifestyle habits and, the supplements and all that. But however, do well to talk to a fertility specialist. And this is shameless plug to our hospitals. Yes, we have a very good fertility specialist that you watch so often. So you can always come in here, book a consultation, and just have a better idea of how your treatments should go or will go. Thank you so much for joining us today. We really do appreciate it. We go live every Wednesdays and Fridays on Instagram, Facebook, and YouTube, sometimes on TikTok too, so be on the lookout for that. Please follow us and turn on your post notifications so you're reminded the next time we're going live. Have a lovely day. Goodbye.